I'm here today with Suellen Miller, and she's going to be speaking at our upcoming Gold Conference, which starts on February 5th. Now, Suellen's going to be talking about innovations in triage and treatment of obstetric hemorrhage, focus on lower resourced settings. Thank you so much for joining us today, Suellen.
You're so very welcome.
Well, of course, this is an extremely important topic, and I'm looking forward to seeing what you're going to share because, of course, in lower resourced settings, things do change, but often we can learn so much when there's less resources, which is really the irony, behind some of, these issues that we deal in a setting where we're high resourced as well. So I'm certainly really looking forward to hearing more about this. But first of all, perhaps you would like to introduce yourself, tell everyone a little bit about yourself, and tell them what you do on a day-to-day basis in your hometown.
Oh, thank you. I'm rarely in my own hometown, but my formal title is Professor of Obstetrics, Gynecology, and Reproductive Health Sciences at the University of California, San Francisco, which is midwifery and nursing and medical school.
Wow.
I'm also the professor in public health, maternal child health, at the University of Berkeley, also the University of California, Berkeley. So I am quite busy, but the majority of the work that I do, at least 40% of my time, is spent in other places than my hometown because I do maternal mortality research and consulting in lower resource settings around the globe.
So you're out of the country quite a bit still, traveling a fair amount, and I guess because you've become quite an expert in this area, people just get to know that, and they call you, they have you come out and see what's happening in their areas. Is that what happens, Sue Ellen?
Well, for the research part, I get grant funding, for example, Gates Foundation, the National Institutes of Health. For consultations, yes, people do contact me and ask if I can come and help assess what's going on in their place and also make some recommendations or develop a protocol for a study or develop a program for implementation.
Wow, that's incredible. So you're tasked sometimes, I imagine, with quite a tall order, being in those lower resource settings. But it must be very rewarding when you can, see a change or try to implement changes in those areas.
It is. It's totally inspirational and it's totally uplifting to be able to go places invited by people, work with midwives, work with ministries of health, and see if there are ways that people have identified that they want change and see if change can be implemented in a way that responds to people's needs.
Excellent. That's wonderful. So great to hear that. I feel like now I need like the whole book on you. I want to know more. I'm hungry for more. But I guess I'll have to
Great.
log back in like everyone else to listen to your full presentation. But it certainly sounds like very rewarding work. Is there something you'd like to share with us today that you've got coming up in your works that what's coming down the pipeline? What are you currently working on?
Yes, I would. One thing that I'm doing is I'm a section editor for the Reproductive Health Journal on a section called Respectful Care in Facilities, and another section which is on female genital mutilation
Oh,
cutting.
okay, yeah.
So, keep me quite busy looking at documents from manuscripts submitted from people all over the world and working with people closely, especially people where English is not their first language, to be able to produce a publishable paper that reflects the context in which people are really suffering living with fistula or I'm sorry, living with genital mutilation or recovering.
So nothing too controversial then, Sue Ellen.
No,
You're just gonna,
I
yeah,
try.
just gonna keep marching through that one, right?
Right. Well, a little bit more controversy, I think, is the work that I'm doing with the World Health Organization and Harvard and EECS, Institute for Clinical Effectiveness Studies in Argentina, and on bundles, postpartum hemorrhage bundles. So bundling different technologies together to make for better uptake of some recognized technologies that have been recommended by the World Health Organization, but there seems to be some lag between the recommendations and implementation.
Yeah,
So we're working to see if we can do something that will make it easier
right.
for uptake.
Yeah. That seems to be, and
Yeah.
that seems to be sometimes a common issue. We've got, good protocols, bad practice. Yeah,
Yeah, there's a
there's a
gap.
gap.
There's definitely
Yeah,
a gap, and between knowledge and
yeah.
implementation, and we're hoping that we can work on that gap. So we've been meeting. We're going to have a publication soon, and then we get into actual implementation.
Excellent. Well, that all sounds very exciting. You'll have to, we'll need updates. Like these are big things that I think people think about in the field. With genital mutilation, that's huge, of course. I mean, if you're in the birth field, you know about it. You're talking about it and you're seeing it. And this is not something that's gone away. It's not something that's resolved. And so there definitely needs to be more, talked about and researched in that area, and prevention, of course, being the key. And then, of course, the other practice that you were talking about, implementation of protocols and speeding up the process once you've got good protocols into practice. So, yeah, you just have to keep us up to date on those things. Okay.
Of course, I will. And the focus of my
Yes.
talk will be on the innovations
Oh.
in maternal
Hmm.
hemorrhage, obstetric hemorrhage, and what is being done globally in high-income countries, but also looking at how this is being translated into care at lower resource settings where there's such obstacles,
Right.
social, economic, traditional, as well as infrastructure like roads, a lack of people with skills to be able to handle this very critical etiology of maternal mortality.
Excellent. That's awesome. Well, lastly, and just briefly, perhaps you could just share with us what you're hoping that the delegates will get out of your presentation.
Well, I'm hopeful that I'll find out, first of all, who the delegates are, where they're from, what their level of experience in a lower resource setting is, and then building off of that, really hope to be able to transmit to people and share with people the knowledge of what kinds of obstacles that there are to women getting quality, respectful care, and at the same time, not over medicalizing childbirth to a point where we're actually doing some harm. And we had a Lancet series on maternal health in 2016, and the title of the paper that we worked on was Beyond Too Little, Too Late, Too Much, Too
Right.
Soon, and trying to find a way where the over medicalization, such as inductions and C-sections, that are skyrocketing in lower and middle income countries, rates up to 60 and 80%
Incredible.
of births are by cesarean, and not have too little too late, not losing women because there was nothing at the place where she showed up to receive
Yeah.
care.
Incredible. Well, I'm certainly looking forward to it, and I'm hungry for more. This has only piqued my interest even further today. So thank you so much. I really appreciate it. And we'll certainly look forward to it. And come join us to come and listen to Professor Suellen Miller. She's going to be live. Check out the website for all the times, dates, and of course your local time zone for all of our speakers. You'll be able to join them. And come and join us. February 5th is our opening day for our keynote. So you won't want to miss out on that for sure. I can't wait to get this started. It's just been great talking to so many speakers like yourself, Sue Ellen, who are so passionate in the field. So thank you again for joining us today, Sue Ellen.
You are so welcome, and it's just an honor and a pleasure. I'm so happy to be able to be doing this. Thank
Thank
you.
you. And thank you to all of our listening audience who joined us. We'll look forward to having you all back again.